Clinical supervision is a cornerstone of professional development in social work. This episode, accompanying therapy training's 6 CE hours clinical supervision for social workers training, offers mental health professionals, counselors, and therapists valuable insights into effective supervision practices. We'll cover key concepts and strategies that enhance supervisory skills, benefiting both new and experienced practitioners in the field of social work. So, what can you expect from this episode? We'll discuss the theoretical foundations and models of social work supervision, enhance your communication skills for effective supervisory relationships, and delve into ethical and legal responsibilities. We will also touch on the importance of cultural competency, various supervision models, and self-reflective practice. Plus, we'll tackle some common misconceptions about supervision in social work and conclude with some thought-provoking insights. Let's dive right in. First up, let's talk about the theoretical foundations and models of social work supervision. Supervision is not just about overseeing the work of others. It's a complex interaction that involves guidance, support, and development. It's critical to be aware of the various models that can inform your practice. In this course, we explore several key supervision models, including administrative, clinical, and task-centered approaches. Have you ever considered how different models can change your supervisory style? For instance, the administrative model focuses on compliance and performance standards, while the clinical model emphasizes clinical skills and therapeutic processes. Task-centered approaches, on the other hand, are more about achieving specific goals and outcomes. Understanding these models allows you to adapt your approach to the needs of your supervisees and the context you're working in. It's about being flexible while remaining grounded in effective supervision practices. Now, let's transition to the importance of communication skills in supervisory relationships. Have you ever found yourself in a situation where a supervisee seems hesitant to share their challenges? This is where effective communication comes into play. The course emphasizes active listening as a key component in building a productive supervisory relationship. Active listening isn't just about hearing the words, it's about understanding the emotions and intentions behind them. When you engage in active listening, you create a safe space for your supervisees to express their concerns and challenges. This lays the groundwork for providing constructive feedback. It's essential to remember that feedback should be a two-way street. Encourage your supervisees to share their thoughts on your feedback so that the dialogue remains open and collaborative. And let us not forget about managing conflicts. Conflicts in supervision can arise over various issues, from differing perspectives on case management to misunderstandings about expectations. Addressing these conflicts head-on, using effective communication, and remaining calm and professional can prevent misunderstandings from escalating and help maintain a positive supervisorial relationship. Next, let's tackle the ethical and legal responsibilities supervisors face. This is a crucial aspect of social work supervision that cannot be overlooked. Supervisors have an obligation to ensure that their practice is ethical and complies with legal standards. This includes understanding informed consent, confidentiality, and maintaining appropriate boundaries. Navigating ethical dilemmas can be especially challenging. Imagine a scenario where a supervisee confides in you about their personal struggles that might impact their work. How do you respond while maintaining confidentiality, but also ensuring that the client's welfare remains the priority? The course teaches that having a framework for ethical decision-making can guide you through these complex situations. It's essential to be familiar with your agency's policies and the National Association of Social Workers Code of Ethics to navigate these waters effectively. Now let's shift our focus to cultural competency in supervision. In today's diverse society, being culturally competent is more important than ever. Supervisors must recognize and address issues related to diversity, equity, and inclusion in their supervisory practice. This is not just a checkbox to tick. It's about fostering an environment where every supervisee feels valued and respected. How can you achieve this? Start by acknowledging your own biases and understanding how they might affect your supervisory style. Create opportunities for open discussions about diversity and inclusion with your supervisees. Encourage them to share their experiences and perspectives. This will not only enrich your supervisory relationship, but also enhance the overall quality of service provided to clients. As we explore these key points, let's address some common misconceptions related to the topic of supervision in social work. One prevalent myth is that supervision is merely an additional burden on an already busy schedule. In reality, effective supervision is an investment in professional development. It fosters growth, enhances skills, and ultimately leads to better client outcomes. Another misconception is that supervisors always have to be the ones with all the answers. In truth, supervision is about collaboration. It's important for supervisors to acknowledge that they, too, can learn from their supervisees. This relationship should be a partnership where both parties can share knowledge and expertise. Now let's circle back to self-awareness and self-reflective practice as supervisors. Have you ever wondered how your own experiences and biases impact your supervisory style? This course emphasizes the importance of fostering self-awareness among supervisors. Understanding your own supervisory style and how it influences your interactions with supervisees is a vital part of effective supervision. Self-reflective practice encourages supervisors to regularly assess their approach and seek feedback from their supervisees. This could be as simple as asking them how they feel about the supervision process and if there are areas for improvement. The goal is to create a culture of continuous learning and growth, both for yourself and for those you supervise. As we wrap up today's episode, let's reflect on some thought-provoking insights. The role of a supervisor is not just a position of authority, it's a commitment to fostering growth and development in others. It requires a delicate balance of guidance, support, and challenge. By applying the principles discussed in Therapy Training's course, you can enhance your supervisory practice and positively impact your supervisees and clients. I encourage you to think about your own supervisory practices. What areas do you feel confident in, and where do you see opportunities for growth? Remember, continuous learning is the key to becoming an effective supervisor. If you're looking to deepen your understanding of clinical supervision and enhance your skills, I invite you to explore more courses offered by Therapy Trainings at therapytrainings.com. Their courses are designed to empower mental health professionals like you to provide the best possible support to your clients and supervisees. Thank you for tuning in to this episode. I hope you found these insights valuable and that you'll implement some of these strategies in your supervisory practice. Remember, effective supervision is not just about oversight. It's about creating a nurturing environment for growth and development. Until next time, keep striving for excellence in your practice, and take care.